Hello, everyone. I'm Dr. Rishav Mukherjee. I am currently a consultant physician. About Bell's palsy, we must understand about the seventh cranial nerve, that is the facial nerve. The facial nerve supplies the muscles of the facial expression as well as provides for the taste sensation from a major part of our tongue, as well as supplies sensations to the lacrimal glands and the salivary glands of our body. Bell's palsy is a disease that affects the seventh cranial nerve. How does it affect? It is basically paralysis of the upper and the lower part of one half of the face. So it's an acute condition. So it develops within, say, within a few hours and it evolves within a few days. This is mostly about Bell's palsy, and although it affects this nerve, in majority of the cases, around 80 to 90% of the cases, the patients do recover in time. Previously, it was known as idiopathic facial paralysis because it used to affect only one half of the face, and cause as yet has not been discovered. There are plenty of etiologic factors behind it, but the cause so far hasn't been found out. In Bell's palsy, what happens is that, if I can just get into a bit of it, like the facial nerve, as it makes its way from the brain it goes across a parotid gland. What happens is it gets compressed somewhere in a structure known as the facial canal. Now, whenever that happens, and because it is supplying one half muscles of facial expression on one half of the face, the earliest symptoms that a patient comes up with is that while he or she is trying to frown, there's loss of wrinkling over the forehead. Like, this is called wrinkling of the forehead. In a Bell's palsy patient, this wrinkling over the forehead is lost. There is facial deviation towards the opposite side of the paralysis. Sometimes there is a loss of this fold, which is known as the nasolabial fold. Since I'm not affected with Bell's palsy, you can see that I have this fold, but in a patient with Bell's palsy, this fold is lost. Also, while the patient is trying to look up, the eyeballs tend to roll upwards, and you can see more of the white of the eye. These are some of the symptoms that patients will come up with. They might complain of dribbling of saliva from one end of the mouth, and inability to close their eyelids. They may also complain of post-auricular pain, that is pain behind the ears, soreness, and loss of lacrimation, loss of taste sensation due to, and also they might sometimes complain that they are having hyperacusis, that they might be hearing sounds of which might not be of a very high intensity, but it is somehow over amplified to them. Generally, it affects both genders almost equivalently, but females have a higher predisposition to be afflicted with Bell's palsy. Pregnant individuals, Bell's palsy affects across all age groups. Now, when during the pre-pubertal years, both boys and girls tend to get equivalently affected. After puberty, females tend to get afflicted more. Diabetic patients with immunocompromised status, like those who are suffering from, say, HIV or any other chronic, say, post-transplant patients, they tend to get affected more. Although it has been termed idiopathic, the majority of the cases, it is due to viral infections. Out of it, infections with herpes simplex virus, as well as even in some cases HIV, cytomegalovirus, and host of other viruses, they tend to be the major offenders in most of the cases. Along with that, diabetes, like I mentioned, diabetic patients, what happens is that these individuals, they tend, compared to a general population, they tend to get affected more. Their recovery rate is also poorer compared to the general population. What happens is that in the general population, if someone gets affected with Bell's palsy, around 80 to 90% of the cases do recover. The issue with diabetes patients is that the recovery is prolonged, and it might not be a full recovery also, right? And in these individuals, the recurrence rate is also very high. Generally, Bell's palsy, it's a single time event in most people, in most individuals, whereas the recurrence rate is somewhere around 5 to 15%. It's not that high. We don't encounter it in our general practice a lot, but the recurrence rate is pretty high in case of diabetic patients. Similarly, in pregnancy, generally it tends to affect even towards the end of their pregnancy. But in general practice, we haven't encountered many such patients of late. During the pandemic era, we were getting cases where people who were infected with the COVID-19 virus, they were having symptoms similar to Bell's palsy. Treatment goal behind Bell's palsy is to identify it first. And after identification, it's mostly a clinical diagnosis. Some clinicians will run basic tests to rule out any other concomitant neurological dysfunction which might be there. So we might be ordering some few blood tests and some radiological investigations. But the treatment generally consists, the goal behind treatment is to restore the neurological function of the seventh cranial nerve as soon as possible, and to target early recovery. And for that, early detection is required, because the best chances of recovery of this weakness, of the facial weakness, happens when treatment is initiated as soon as possible, once it is diagnosed. So there are plenty of drugs in the armamentarium which we have. Some patients are given antivirals if they are presenting within 72 hours of the onset of their first symptom. Then we have corticosteroids and so on and so forth. And there are some supportive measures we take along with that. If the person is diabetic, we go for good glycemic control of those individuals. And along with that, we also advocate the usage of facial physiotherapy, so that patients can recover quickly. Because if the treatment is delayed beyond, say, if it is delayed beyond 3 weeks, the chances of recovery sometimes goes down a lot. Now, I have said this before, that most of the patients, they do recover fully. They do recover the functions within, say, a span of, say, a month to extending up to 6 months. It takes time, but they do recover fully. But a small percentage of patients, they might have, like say around 5 to 10% of the patients, they might have some residual paralysis, which may affect their daily quality of life. And a more minuscule percentage of individuals may also persist with residual paralysis, which makes eating, drinking liquids a bit difficult. And what happens is, because it affects the muscles of one half of the face, what happens is the facial nerve also supplies the muscles which helps us to close our eyes. So once that is affected, what happens is the eyelids remain open. And as you know, that blinking is very important for keeping our eyes safe from dust particles, from chemicals and other irritants. So what happens in these individuals is that because the eyelid is not closing properly, there is a lot of corneal abrasion and corneal damage. So that is one major point that as physicians, we, in conjunction with ophthalmologists, with rehabilitation physiotherapists, we do have to look into that aspect very much, because of the high chance of damage to the cornea, which is very important for vision. Along with that, there are certain rare complications that we have encountered, like this generally happens in individuals who have not recovered fully. They develop some serious complications which requires a lot of follow-up, a lot of say sometimes surgical procedures might be required to decompress the facial nerve within the within the facial canal. So these are the things that we basically it is done. But to outline the basic management prospect of it is reassurance. It is certain drugs like antivirals and corticosteroids that are administered by the doctors. Along with that, rehabilitation, which plays a major part in achieving full recovery of the affected of the affected muscles. If a person's there's a deviation of the angle of the mouth, a person is unable to close his or her eyes, and he's not able to make any facial expressions, so then definitely that person will have to seek consultation, because Bell's palsy is an isolation, is an isolating event where it is affecting only the seventh cranial nerve. But when these individuals do recognize these kind of symptoms, the first thing that will come to their mind, is it a form of stroke? Well, it is. And like we have the mnemonic fast in stroke, that is, if you have any kind of facial weakness, if you have any kind of weakness in your arms, if your speech is altered, those are the symptoms that you must look out for, and you must rush to the doctors to get it checked up on. And definitely early recognition leads to better response to therapy and better recovery. Prevention of Bell's palsy is not, there is no hard and fast rule that these things have to be done in order to prevent Bell's palsy, because like I said, the cause behind it is still not known. There is no direct causal relationship between a lot of agents, most of them viral infections, with the occurrence of Bell's palsy. Now, it may happen that someone has had a cold sore on his or her lips, and say after a few years, maybe the patient has had a history of fever or recent illness, and suddenly after say like 2 weeks or 1 week after that illness, he develops symptoms suggestive of Bell's palsy. So there is nothing that can really predict like who is at more risk of having Bell's palsy. Of course, elderly individuals, immune compromised individuals, diabetics who have very poor glycemic control, post transplant individuals who are at higher risk of having any sort of infections. These individuals are at greater risk. So, but there's no big preventive measure that we can take to prevent this from happening.